I've went through college for policing, and at the end I was basically told, yeah, you'll never be on like patrol or anything. You'd be stuck in an office because they don't want the risk. Fetal stroke is just classification of stroke which happens before birth. However, due to having a stroke while being a child, it's classified as cerebral palsy.
So we do see stroke happening across all age groups. And we are doing our best now to help, especially that young stroke survivor, because they're wanting to return to work or to school or to their own activities. So that's something that's become a real focus in our work now.
It has affected me in a huge way. It's caused financial problems, social problems, professional problems even. It's really hard because for the professional aspect, no one wants the risk of having someone with cerebral palsy or who's had a stroke do something happen on the job where a normal person it would not happen to.
Results can be very different. I think that's the unique thing about stroke, is that it can be very, very minor, or it can be quite devastating for the patient. And sometimes patients are coming in with quite minor symptoms, a bit of tingling in the hand, or maybe a little bit of a drooping they notice in the face. Or it can be quite severe where, patients require rehab here in our hospital for quite a lengthy time.
I used to have to do stretches just to maintain my ability to walk and my mobility for about 2 hours a day. I was never supposed to walk. I was never supposed to talk. I never talked until I was 5. I walked when I first walked, the physiotherapist said that I should have never even walked. So
it really depends on how the stroke has affected them, but also on their goals. What do they really want to achieve? Is it just being able to go to the grocery store again, or is it just being able to talk on the phone, or is it returning to work? It could be something that they really want to achieve.
I was heavily influenced by sports. When I've grown up, I used to watch football every Sunday with my dad. I used to want to play football for high school and that, but I was told that if I were to break any of my limbs, that it would be just devastating for me because I would not be able to function. So I ended up playing sledge hockey, which is it's a huge sport now. I'm involved with heart and stroke, of course. I'm also involved with New Beginnings and fundraising for them through United Way, as well as I sit on the board of directors for New Beginnings.
I know that Derek is involved in quite a few different committees, and he is always bringing forth, hey, wait a minute, what about the young stroke survivor? So he's actually been a huge advocate for the young survivor. And we do see a need for that here in Chatham-Kent.
We're partners on a committee, and we're holding a stroke congress this spring in Chatham, which is going to draw many people from Southwest Ontario and beyond. And it's going to be for survivors and their families to come out. And Derek has actually been instrumental in that committee. He's helped us see that we need to make sure that we're including the voice of anyone who's younger, who's had a stroke. And so we're making sure that we're including all of his knowledge and making it a great stroke congress. All of the funds that are raised from our donors and supporters, they go through research, advocacy, and health promotion. The past 60 years, the Heart and Stroke Foundation has invested $1.3 million in life-saving research. Some of the milestones include the clot-busting drug TPA and identifying the blood pressure hormone. There's so many questions left unanswered, especially about strokes in young people, especially in Derek's case. So it's very essential that we raise money for research and answer those questions that are left unanswered, so we can see that there's hope for people who are like Derek and live with stroke.
I'm hoping to go back to to go to university and get my criminology degree. So my ideal profession would be a lawyer, because yeah, I just love the law. Basically, to have a family, to enjoy my life, because I've missed out on so much life experiences, and I'm just eager to explore new life experiences I could have. Yeah, I'm living on my own right now, enjoying every second of it.